Cynthia Dela Cruz, RN. She watched. Dr. Whitman stood at the foot of the bed, tall, shoulders loose with confidence, one hand already tugging off a glove like the case bored him. "Okay," he said, loud enough for the room. "Classic allergic reaction, probably food, maybe shellfish. We'll push antihistamines, observe discharge by morning." The patient's wife shook her head. "He didn't eat anything new." Whitman smiled without warmth. "People say that all the time." A few nurses exchanged looks. A resident chuckled softly. Cindy leaned forward half a step. "Doctor," she said, voice calm, almost gentle. "The pattern on his skin, it's not urticaria. The edges are wrong. It's purpuric." Whitman didn't look at her. "It's hives," he said. She didn't retreat. "Sir, the discoloration started distal and moved inward, and the fever spiked before the rash. That's not typical." Whitman turned then. Slowly, he looked her up and down, the shoes, the badge, the accent that barely touched her vowels. "Nurse," he said, stressing the word like a reminder. "I didn't ask." A ripple of laughter passed near the doorway. Cindy nodded once. "Understood." She stepped back. The wife clutched the bed rail. "He's getting worse." Whitman sighed. "I do this for a living." Another chuckle. The resident leaned in, probably anxiety making it look dramatic. "Exactly," Whitman said. "Let's not panic." The monitor chirped again, louder this time. Cindy watched the rash creep, slow, deliberate. She had seen this before. Years ago. Manila General. A journal article she'd argued over with 3 consultants and a visiting German specialist. She spoke again. "Doctor, with respect, this could be vasculitic. If it's progressing this fast, antihistamines won't touch it." Whitman laughed. Actually laughed. "Wow," he said. "Okay, everyone take a breath. Nurse, what was your name?" "Cindy." "Cindy," he repeated, smiling wider. "I appreciate enthusiasm, really, but this isn't nursing school." The resident smirked. She Googled WebMD. Laughter again, louder. The wife looked between them. "She sounds like she knows." Whitman cut her off. "Ma'am, please, we're handling it." Cindy felt eyes on her. Other nurses. A tech by the door. The way people looked when they'd seen this play out before and already knew the ending. She said nothing. Whitman snapped his gloves into the trash. "Let's get the meds going." A nurse hesitated. "Doctor, his blood pressure is fine," Whitman said. "Until it isn't." The words landed wrong. Even he seemed to feel it. He waved a hand, dismissing the tension. Cindy moved closer to the bed anyway, checking the IV. She noticed the faint mottling on the patient's legs now. She spoke quietly. "Sir, has he had any recent infections? Travel? New medications?" The patient tried to answer but coughed instead. Whitman turned sharply. "Are you questioning my differential?" "No," Cindy said. "I'm offering information." "Unsolicited," he said. "Repeatedly." The resident laughed again. "She's really committed." Whitman leaned closer to Cindy now, voice dropping just enough to feel personal. "Listen," he said, "I know where this comes from. Back home, maybe you were important. But here, you follow orders." The room went still. The wife stared at him. A nurse swallowed. Cindy held his gaze. Calm. Flat. Not angry. "I am following the patient," she said. Whitman straightened. "Enough. Step back." She did. The meds went in. Minutes passed. Then the monitor screamed. The patient convulsed slightly, eyes rolling, breath hitching. "What the hell?" Whitman said. The resident froze. "BP's dropping," the wife screamed. Cindy was already moving. "He's crashing," Whitman snapped. "Epinephrine, now!" Cindy shook her head. "It won't." "Now," he shouted. She hesitated for half a second, then administered. Nothing. The rash darkened, purple now, almost black at the edges. The room filled with noise, orders, alarms, panic. Whitman barked instructions that didn't land. The resident fumbled. Cindy spoke clearly. "This is small vessel vasculitis, possibly infectious. He needs high-dose steroids and labs for cryoglobulins. Now." Whitman turned on her, face flushed. "You are not the doctor." The door opened. A woman stepped in, older, sharp-eyed, authority in the way the room seemed to recognize her before anyone spoke. Dr. Elena Morales. Infectious disease. She took in the scene in one glance. The rash, the vitals. Cindy's hand still steady on the IV. "What's happening?" Morales asked. Whitman exhaled like relief. "Allergic reaction gone wrong." Morales frowned. "Allergic?" She moved closer to the bed, eyes narrowing. Then she looked at Cindy. "You," she said. "What do you think?" Whitman stiffened. "Doctor," Morales held up a hand. "I asked her." Cindy met Morales' eyes. "Rapid onset purpura. Fever precedes rash. Likely vasculitic process. Epinephrine ineffective. Needs steroids. Possibly infectious trigger." Morales' face changed. Not surprise, recognition. She turned back to Whitman. Why hasn't this been escalated? Whitman opened his mouth, closed it. Morales looked at the chart, then at the rash again. She nodded once. Get me methylprednisolone now, she said, and page rheumatology. The room shifted. The resident stopped smiling. Whitman stared. Elena, this is... She cut him off. This is correct. Silence pressed in. Morales glanced back at Cindy. Where did you train? Cindy answered evenly. University of the Philippines, dermatology. Morales' eyes sharpened. UP? Yes. A beat. Morales smiled. Not wide, not kind. Real. Oh, she said softly. You're that Cindy Dela Cruz. The words landed heavy. Whitman frowned. What? Morales turned to him. She published 3 papers on vasculitic skin disorders. One of them changed how we classify early-stage presentations. The room went dead quiet. The wife covered her mouth. Morales continued. I cited her work in my fellowship. Whitman's face drained. Cindy said nothing. The hierarchy collapsed in real time. And the monitor finally began to slow. Dr. Whitman recovered first. Not because he was right, because he was practiced. He straightened his coat, rolled his shoulders back, reclaimed his voice. Okay, he said, louder than necessary. Let's not rewrite history here. We're all on the same team. No one laughed. The resident stared at the floor. Morales didn't look at him. She was already snapping orders, already pulling gloves on. Steroids, broad-spectrum antibiotics, ICU prep. The nurse moved instantly. Whitman cleared his throat. Elena, with respect, this is my patient. Morales finally turned. Not anymore. The words were flat, administrative, final. A ripple passed through the room, quiet, electric. Nurses straightened. Someone near the door stopped whispering mid-syllable. Whitman smiled tight. Of course. I just mean I was already considering vasculitis. I didn't dismiss it. Cindy said nothing. Morales raised an eyebrow. You administered epinephrine. For airway protection, Whitman said quickly, as a precaution. A precaution against a non-allergic process, Morales replied, after being advised otherwise. Whitman laughed again, softer this time. Advised by a nurse. The word hung there. Morales' gaze sharpened. A nurse who happens to be a published expert. Whitman waved a hand. Credentials from overseas don't always translate cleanly. We all know that. The wife flinched. A murmur started near the door. Low. Uncomfortable. Cindy watched the patient breathe. Slower now. Better. Morales didn't break eye contact with Whitman. Science translates. Data translates. Outcomes translate. Whitman swallowed. Look, this isn't about ego. It's about protocol. Then follow it, Morales said, because right now protocol says you listen. The resident shifted. Dr. Whitman, maybe. Whitman snapped, not now. The room heard it. The sharpness, the desperation creeping in. Morales turned to the resident. What did you observe? The resident hesitated, glanced at Whitman, then away. The rash pattern was unusual. Whitman stared at him. You didn't say that earlier. I assumed. That's the problem, Morales said. You assumed hierarchy instead of evidence. Silence pressed down again. Whitman tried a different angle. Elena, you're overcorrecting. We can debrief later, privately. Morales shook her head. No, this stays public. Cindy felt the shift then, the room leaning, the audience turning. Whitman noticed too. He smiled again. Fine. Public. Let's talk about scope of practice. Morales crossed her arms. Let's. Whitman gestured toward Cindy without looking at her. She is not licensed as a physician here. No, Morales agreed. She's licensed as a nurse. Then she does not diagnose. She recognized, Morales corrected, which is what saved your patient. Whitman scoffed. Saved? We'll see. The words landed wrong. Even he seemed to realize it too late. The wife stepped forward. She was the only one who listened. Whitman opened his mouth, then closed it. Morales nodded toward the wife. Ma'am, your husband would have lost renal function within hours, possibly worse. The wife's knees buckled slightly. A nurse caught her. Whitman's face flushed red. This is speculation. Morales didn't blink. This is experience. She turned to Cindy. How many cases like this have you seen? Cindy answered quietly. Enough. Whitman laughed again. A short, brittle sound. That's not an answer. Morales said, it's a devastating one. A whisper loop started. Not laughter this time. He almost. She knew. Why didn't he listen? Whitman raised his voice. Everyone calmed down. No one did. He tried to stand taller. Elena, if this turns into a liability issue, Morales cut him off. It already is. She glanced at the chart again. You documented nurse anxiety as a contributing factor. Whitman froze. Cindy hadn't seen that, but she wasn't surprised. Morales looked up. Explain. Whitman's mouth opened, closed. It was shorthand. For what? Morales asked. For interference. Cindy finally looked at him. Not angry, not triumphant, just present. Morales followed her gaze. You dismissed correct information because of who delivered it. Whitman shook his head. That's not fair. It's accurate, Morales said. The resident spoke, barely audible. She tried to tell us, twice. Whitman turned on him. You're undermining me. The resident straightened. I'm telling the truth. That did it. The room went silent in a way that felt irreversible. Morales exhaled. Dr. Whitman, step outside. Whitman blinked. Excuse me? Now. He laughed again. Reflex. You don't have the authority. The charge nurse appeared at the door. She does. Whitman looked around. Really looked. No one met his eyes. He straightened his coat again, one last time. This is ridiculous. Morales didn't move. Go. He walked out. The door closed. The silence broke differently now, softer, relieved. The wife turned to Cindy, tears streaking her face. Thank you, Cindy nodded. He's strong. He'll recover. Morales watched her. You didn't push. Cindy shrugged slightly. I offered. Morales smiled. That's power. A few minutes later, the door opened again. Whitman stood there, smaller somehow, whilst two administrators behind him. He cleared his throat. I'd like to re-enter my patient's care. Morales didn't turn around. Denied. Whitman stiffened. On what grounds? Morales finally faced him. Pattern of dismissal, unsafe judgment, documented bias. The word hit hard. The administrators exchanged looks. Whitman said, this is an overreaction. One administrator spoke. We'll review. Morales nodded. Good. You'll find a trail. Whitman looked at Cindy then. Really looked. You should have said something about your past, he said. Cindy met his eyes. Calm. Unmoved. You didn't ask, she said. That was it. No speech, no victory pose, no smile, just truth. The administrators asked Whitman to step aside. The door closed again. This time it stayed closed. The room exhaled. Cindy returned to the IV, adjusted it slightly, same posture, same calm. Nothing about her had changed. Everything else had. The ICU lights hummed with a low, constant vigilance. The patient slept now, sedated, breathing steady, color slowly returning to his face, the purple retreating like a tide that had gone too far. Cindy checked the drip, adjusted the line, wrote a note in careful, compact handwriting. Around her, people moved differently. Quieter. A nurse passed and gave her a look, something between gratitude and apology. Another paused, then said, I've seen that rash before. I just didn't trust myself. Cindy nodded. Next time, trust the patient. The words stayed with them. Down the hall, a small conference room filled. Whitman sat at the table, hands folded too tightly. His leg bounced. He stopped it, started again. Across from him, Morales, two administrators, a risk officer, a door closed, soft, final. This isn't disciplinary, one administrator began. Whitman leaned forward immediately. Good, because this has spiraled. Morales didn't look at him. The risk officer spoke. Let's walk through the timeline. Whitman talked fast, confident again at first, the way he always did. I assessed. I ordered standard treatment. The nurse interfered. Morales interjected calmly. She advised. Whitman ignored her. The patient destabilized. I responded. The risk officer glanced at the chart. After ignoring documented input, Whitman stiffened. Input from someone not credentialed to. The administrator held up a hand. We've reviewed her publication history. Whitman blinked. Why? Because, the administrator said, you wrote nurse anxiety as a factor. Whitman swallowed. The risk officer continued. That phrase appears in 3 of your recent charts. Whitman laughed once. Weak. It's common shorthand. Morales finally spoke. It's common for you. Silence. The administrator leaned back. Do you understand how this reads? Whitman's voice sharpened. Like efficiency. Like bias, Morales said. Whitman snapped. That's a serious accusation. So is negligence, the risk officer replied. Whitman looked at Morales. You're enjoying this. Morales didn't react. I'm correcting it. The administrator folded their hands. Effective immediately, you're being removed from direct patient care pending review. Whitman's chair scraped back slightly. You can't. We can, the administrator said, and we are. Whitman shook his head. Because of a nurse? The administrator's voice cooled. Because of your behavior. Whitman sat back slowly. The power he'd worn like a coat slipped off him, thread by thread. Back in the ICU, the patient's wife spoke softly with Morales. She thanked her, thanked Cindy again. Morales said, she did the hard part. The wife squeezed Cindy's hand. You saw him. Cindy nodded. That's my job. Word spread. Not loudly, not officially. But it moved. through the nurse's station, through residents' phones, through the break room where someone said, "Did you hear?" And no one laughed this time. Whitman walked the hall later, escorted. People moved aside, not in respect, in avoidance. A resident he used to joke with stared at a chart when Whitman passed. A nurse didn't look up at all. Whitman stopped near the nurse's station, saw Cindy there, charting. He hesitated. Then he spoke. This didn't have to be like this. Cindy didn't look up. It always is. He frowned. What does that mean? She met his eyes. For people like me. He opened his mouth, closed it. Nothing he said would land now. Morales appeared beside Cindy. We're putting together a consult pathway. Cindy nodded. Good. Morales added, loud enough to be heard, we'd like you to lead it. Whitman flinched. Cindy paused. Just a second. I'll help. Morales smiled. I know. Whitman watched them walk away. The room didn't follow him anymore. Later, the chart updated. Primary consultant, C. Dela Cruz, RN, dermatology specialist. No announcement, no ceremony, just truth written where it could be erased. Whitman sat alone in an empty office, badge heavy in his hand, the walls suddenly too thin to protect him. Outside, Cindy washed her hands, dried them, returned to work. Same calm, same restraint. Authority didn't arrive with noise, it simply settled where it belonged.